Welcome to JRTV. Now, the squamous cell carcinoma, the cancer, the malignant cancer most commonly seen in oral cavity because of different oral habits and the exact etiology of the cancer is unknown because of regular irritation to the oral tissue of any etiology from sharp attritioned teeth or buccal bite or tongue bite. Any sharp object will chronic irritation will leads to malignancy or malignant transformation in soft tissue level in oral cavity. So, number of factors influencing this malignant squamous cell carcinoma, chronic smokers and reverse smoking and pan chewing habit of different pungent nut powders, regularly chewers, especially the drivers from long distance who will reach long destination from kilometers together. They will travel in lorries and logistics. So, there will be for avoiding this sleep, they will take pungent nut powders in buccal mucosa level and labial, upper labial and lower labial, the labial surfaces, they will keep the nut powders in that groove of between lower tooth and labial side. So, the chronic pungent irritation to the soft tissue in labial muscles or labial mucosa get irritated and there will be tissue changes in tissue level and there will be a malignant transformation and there will be a cauliflower like growth with proliferation of oral tissue and there will be food impaction in that grooves and crevices of this squamous cell carcinoma. So, the most common cancers in the oral cavity is squamous cell carcinoma. So, different chronic bad habits will leads to this squamous cell carcinoma, carcinogenic growths in oral cavity. So, in the initial stages, we can arrest the this squamous cell carcinoma in initial stages. So, we can minimize the cancer carcinogenic effects in drivers by tapering these bad habits, smoking and pan chewing and chronic bruxism also. Chronic bruxism means chopping of teeth continuously in nocturnal and daytime bruxism also. In the bruxism, the buccal tissue, the buccal mucosa get crushed by upper maxillary teeth and lower mandibular teeth, and the tissue gets proliferated like cancerous growth in buccal mucosa. Sometimes the syphilitic patients also, chronic syphilis, chancre and with bad oral habits also, the causative factor for growing this squamous cell carcinoma in oral cavity. So, sharp teeth gets the dentist can smoothen the sharp knife edged efficient teeth with beveling and smoothening and without any continuous injury to the oral cavity, without any irritation or probing or any pricking sensation. It will, the dentist can minimize the chronic irritation by high speed diamond burrs with steel burrs or different smoothening oral burrs. So the chronic irritation we can minimize with dentist by smoothening, and in some cases regular reverse smoking patients, especially in Vijayanagaram and Srikakulam division, most commonly they use to smoke reverse smoking. So in reverse smoking, the edge of the tip, the chutta or bidi or cigarette, the tip will constantly in touch with palatal mucosa or onto the dorsum of the tongue. So there will be chronic continuous reverse smokers or chain smokers. There will be tissue changes in palatal mucosa or labial mucosa or buccal mucosa or tongue, the dorsum of the tongue. So there will be profuse growth in like cauliflower like growth, and there will be food impaction in that grooves and crevices of this squamous cell carcinoma. The patient unable to open the mouth, that is a trespass condition, and there will be continuous foul smell, halitosis, the bad breath from the oral cavity, and there will be food impaction, and there will be super infections and fungal infections, and there will be tender and palpable and painful submandibular lymph nodes and sublingual lymph nodes and cervical lymph nodes. There will be in squamous cell carcinoma. So there will be dysphagia and difficulty in deglutition, and the patient weight continuously 2 to 3 kgs per 15 days. There will be reduction of depletion of patient's weight, and there will be super infections and lung infections, and there will be continuous fever, cough, and dysphagia, and difficulty in deglutition, and difficulty in opening of mouth, and difficulty in speech also impaired, and there will be hoarseness of voice, and the oral cavity very minimally, means 2 to 1 centimeter to 1.5 centimeter only the patient can open the mouth, and only fluid diet we can advise, and the treatment part is we have to take biopsy in the early stages, and we can see the in which stage the squamous cell carcinoma is. So after that we can go for radiation and chemotherapy. So if and in some cases there will be amputation of affected bone and affected side, right side, either left right mandibular half, or left mandibular half, or upper right maxillary half, or front maxillary quadrant or front mandibular quadrant or left side maxillary half or left side mandibular half, we have to amputate and we have to fix the prosthesis similar to the right side part, and the occlusion should be in contact with each other. So the most cancerous, the most common cancers of oral cavity is squamous cell carcinoma. So we have to educate the patients not to smoke, bidi, chutta, cigarette, and reverse smoking, and chronic smokers also. We have to give educative sessions, and we have to educate the patient not to take pungent nut powders and tobacco chewing and pan parag and pungent nut powders we have to avoid, and we have to terminate the habits, and only the oral cavity, we have to keep the oral cavity in good, healthy and hygienic and with good conditions. So squamous cell carcinoma is most commonly infiltrate in buccal mucosa and mandibular region and upper maxillary region and into the sinuses also. Ethmoidal, it will infiltrate into ethmoidal sinus, maxillary sinus, and so it can infiltrate in anywhere, and the cancerous cells metastasis into brain, near vital organs, brain, heart, and lungs, most commonly in lungs, liver, and kidneys. So the very dangerous and highly carcinogenic cancers are oral cancers. Oral sex and chronic syphilitic and gonorrhea patients may also get this oral cancers, and most commonly the bad habits of oral cavity leads to squamous cell carcinoma. So in the initial stages we can the prognosis in malignant carcinoma is very poor, means only 5% of malignant cancers patients can survive. In acute stage, means initial stages of malignant carcinoma, we have to taper the oral habits, and we have to educate the patient not to take all irritant. Chronic irritant will is the causative factor for producing carcinoma. Any chronic irritation, it may be chronic pungent nut powders, or heat, severe heat from reverse smoking, or any attritioned or sharpened teeth by injury in bruxism, or regular injury to the oral tissue leads to, there will be malignant transformation of soft tissue in oral cavity, leads to highly carcinogenic squamous cell carcinoma. Most commonly squamous cell carcinoma onto the lingual, tongue, onto the dorsum of the tongue, and buccal mucosa, and labial mucosa, and gingival tissue, and palatal tissue. There will be in if the squamous cell carcinoma onto the palate, there will be perforation of the palate because the infiltration into soft palate and hard palate. So, there will be perforation to the palate leads to regurgitation of if patients take water, there will be regurgitation, there will be dribbling of fluids from the angle of the mouth. So, the deglutition in that cases, the deglutition of food or liquid or any juices will be very difficult. It will the fluids will return back from angle of the mouth or from the nostrils. So, most commonly oral cancers, the squamous cell carcinoma in buccal tissue and palatal tissue, lingual tissue, labial tissue and floor of the mouth also most commonly seen. Halitosis. Halitosis is a clinical condition from oral cavity. The bad breath from the oral cavity is halitosis. So many causative factors influencing this halitosis. Number 1, decayed teeth and chronic suppurative periodontitis and periodontal infections and squamous cell carcinoma, carcinoma of oral cavity of any etiology, and there will be gingival abscess and cystic lesions and chronic bronchitis and chronic upper respiratory tract infections and peritonsillar abscess and this intestinal worm infestations, roundworm, ringworm, earthworm, the roundworm, ringworm and tapeworm and fishworm infestations. The patient will get the bad breath from the mouth. In constipation also patients will get bad breath, and in anti-convulsive drug therapy means gingival hypertrophy. So, there will be a very difficulty in keeping the oral cavity in hygienic conditions. In that situation, there will be profuse foul smell from the oral cavity. There will be halitosis, continuous bad breath from the mouth. In squamous cell carcinoma, from long distance we can identify and distinguish and differentiate the oral cavity the patient is suffering from squamous cell carcinoma, because from long distance also we can distinguish the patient is suffering from squamous cell carcinoma by with chronic smoking and chronic oral nut powder chewing habits and pan parag and pan chewing habits also, the patient will get foul smell from the oral cavity. So, in chronic suppurative conditions, because the oral cavity, poor oral hygiene will leads to super infections and periodontal pockets. There will be pus discharge and blood discharge from the gingival pocket, and gingival crevices will leads to profuse foul smell from the oral cavity. So, in that condition, metrozil 200 mg 3 times daily and metrozil mouthwash and metrozil paste for oral applications we have to apply, and before that we have to refer the case to dental surgeon, whether BDS or MDS, so that the specialized periodontist will clean the calicculus or tartar by a cavitron machine, highly sophisticated and less lacerative, less invasive and less traumatic conditions, he will clean with highly sophisticated equipment and keep the oral cavity in good, healthy and oxygenated condition. So, in oral in halitosis condition, the patient will get gastrointestinal disturbances and repeated upper respiratory tract infections, cough and sore throat and bronchitis and tonsillar infections and streptococcus and staphylococcus infections repeatedly, and it will leads to mitral stenosis because of rheumatic fever. In rheumatic it will leads to rheumatic fever, so there will be damage to the mitral and bicuspid walls of the cardiac chambers. So, there will be in rheumatic fever there will be joint pains and different patient complaining with different symptoms like swan neck deformity, ulnar deviation, interstitial muscle wasting, and there will be grooving in phalangeal region and puffiness of face and baggy eyelids, and there will be swelling in knee joint, ankle joint and hip joint and even elbow joint and humerus joint. In anywhere in the body the joint get swollen and the patient continuously complaining of pains in joint and swan neck deformity. The deformity in phalangeal region is just like swan neck deformity. So, swan neck deformity, so patient will complain many symptomatic problems, and if the oral cavity in good and healthy, hygienic and oxygenated condition, the total body will be in good condition. If the oral cavity the patient is suffering with chronic suppurative periodontitis, there will be gastrointestinal disturbances like diarrhea and vomitings, and kidneys also get impaired due to continuous pus and blood discharge from periodontal pockets, and the patient will engulf by at the time of taking food inside the pus and blood streaks mixed with the masticatory food and will go into stomach, and from the stomach duodenum and small intestine, large intestine, like that there will be gastrointestinal disturbances like diarrhea and vomitings, and in liver also gets damaged, and even kidneys also get impaired due to infected this purulent infection will distribute into vital organs. So, multiple clinical conditions for a patient with chronic suppurative periodontitis, patient will complaining of knee problems and gastrointestinal problems and upper respiratory tract infections and skin problems, skin itching, because the kidney there will be renal insufficiency, there will be itching of kidneys because dry skin and polyphasia, polyuria, polydipsia and pruritus and polyneuritis like diabetes. In these are the 5 symptoms in diabetes, because the kidney get impaired in due to oral unhygienic oral conditions, and the foul smell also leads to decomposition, due to decomposition of the oral tissues may leads to foul smell from the oral cavity. So, there will be for maintaining a good oral hygiene, Listerine, Cavison and Colgate and different Metrozil, like that so many mouthwashes are there. From for one scoop of concentrated mouthwash, we have to add 5 to 10 times of the water dilution, so that the harmful bacteria in the oral cavity which will aggravate this foul smell or gingival infections will killed by this oral mouthwashes. And before that we have to go to dentist and thorough oral checkup and necessary treatment like scaling and scaling by hand scaling. After that cavitron, like that 4-5 sittings every weekly 4-5 sittings he will advise, and we can take better treatment from the dentist like periodontist, and if there is any proclination of teeth, we have to go for orthodontist, and if there is any cavity in the teeth, different departments they will give better treatment for better oral cavity. So, in halitosis condition, in constipation and in starvation also there will be halitosis, and in fasting also there will be halitosis. In pregnancy ladies also there will be because of early sickness they avoid brushing. So, for vomitings they avoid long time brushing. So, there will be halitosis from the oral cavity. So, so many causative factors which will influence this halitosis of oral cavity. So, if the oral cavity is in a good, healthy and fresh and rejuvenating condition, the entire vital organs will be energetic and rejuvenated and with highly oxygenated. The brain will gets very sharp, and the lungs will be more oxygenated if the oral cavity is in a good, healthy and hygienic condition. If the oral cavity is in good and healthy oxygenated condition, the kidneys will work, the kidneys will be more effective and the liver will be more effective, and the gastrointestinal system also very healthy, and there will be regular bowel movements, and there won't be any constipation or diarrhea or dysentery or any nauseating problems. And if the oral cavity is healthy, there won't be any rheumatic fevers and rheumatoid arthritis, and there won't be any puffiness of face and baggy eyelids. There won't be any water retention in the body, and there won't be any swelling of pitting edema in lower limbs, and there won't be any joint swellings, and even the liver, the core organ of the metabolism, liver also will act very energetic and active, and the patient will be in a very active mode, and any stagnated gingival hypertrophy. In anti-convulsive drugs, if the patient continuously, if patient uses anti-convulsive drugs, there will be gingival hypertrophy. The gingival tissue gets hypertrophied, and it will cover the total labial side, buccal side, and palatal side, occlusal side. It will cover everything. Means if we test the oral cavity, the patient looks like edentulous. So in anti-convulsive drugs, the most side effect is the gingival hypertrophy leads to halitosis conditions, because in hypertrophy the patient is complaining of this inability in cleaning of teeth, because the gingival tissue almost it will cover three-fourth of this three-fourth of dental structure. So only occlusal part, in some cases even occlusal part also covered with gingival tissue. There will be proliferation in the gingival tissue, and it will cover the labial side and the interstitial side, the buccal side, occlusal side, and in between teeth also, interdental space also, the gingival tissue gets hypertrophied, and it will cover the total occlusal all areas, and the patient, if the patient if patient opens a mouth, there will be edentulous, looks like edentulous. So in that cases continuous oral checkup, and there will be a continuous checkup with periodontist, periodontist MDS, so that he will gingivectomy operation can be performed with aseptic precautions and minimally invasive surgery like laser cutting, and he will pack this the gingival eugenol paste, and even he will drain the periodontal pockets also. So in hypertrophy, gingival hypertrophy, there will be food impaction in between the gingival crevices and in between the interdental spaces, and there will be frequent periodontal pockets, and there will be halitosis from the oral cavity, and difficulty in taking food, and mastication also very difficult, because there will be profuse bleeding. If patient if the patient advised to take hard food, there will be profuse bleeding, and even some chronic cases pus discharge also. So soft diet, liquid diet, and fresh vegetables is advisable in that cases. So in chronic anti-convulsive treatment, the oral cavity should be absolutely clean and neat and energetic and rejuvenated condition. So if the patient taper the drug treatment, the oral cavity will be in normal conditions. Means the hypertrophy get atrophy, hypertrophy conditions become atrophy, and normal conditions in 6 to 8 months. So the most adverse effects is getting periodontal pockets, and repeated gingival infections, and chronic suppurative conditions, and even some cases mobility of teeth because of apical abscess and apical cysts formation, and chronic gingival infections. Also there will be oozing of teeth from the gingival tissue, and there will be supra eruption, and there will be drifting of muscles if there is any gap between two teeth. There will be drifting. The anterior abutment will drift, declining posteriorly, and the posterior abutment will decline anteriorly. Like that there will be drifting, and there will be spacing of two teeth, and there will be food impaction, and leads to halitosis and foul smell and bad breath from the oral cavity. This bad breath will ultimately results this chronic throat infections and bronchial chronic bronchitis, and chronic acute tonsillar infections, acute sore throat, and streptococcus and staphylococcus infections, and even lung infections also because of convulsive treatments. There will be repeated lung infections, and there will be frothy sputum from the mouth, and viscous viscid and viscosity sputum from the mouth, and there will be pleural effusions and pulmonary effusions, and sometimes bronchiectasis, and even pleurisy conditions also. All lung infections will be, the etiology is the bad, if patient keeps the mouth in bad conditions, it will reflect that near vital organ, the pulmonary organ. The pulmonary lungs, left and right lobes of the lungs get affected, and repeatedly there will be cough, cold, sinus infections, and upper respiratory tract infections, and peritonsillar abscess, quinsy, and lung infections, pleurisy, and pulmonary effusions. Like that more causative factors for lung infections is poor oral hygiene. So the repeated infected bacteria from oral cavity will aggravate, will stimulate, will proliferate, and will the bacterial flora will become 10 times more in lung tissue, because there will be huge space in bronchial trees and bronchus and this thing. So if the oral cavity in good condition, the lung there will be free of lung diseases and oral infections and tonsillar infections, and even cardiac infections, cardiac problems like mitral stenosis and aortic stenosis, and bicuspid regurgitation and carotid regurgitations, like that. Because if the oral cavity is in a healthy condition, the heart also in healthy condition, the lung also in healthy condition, the brain also in rejuvenated and oxygenated and active condition, and the kidneys also will be very active and oxygenated and very rejuvenated condition, and it will remove all the toxins and waste minerals and metals from the body in the urine. So in anti-convulsive drug, we have to advise patient regularly. The patient should visit the nearest dental periodontist. So the gingival tissue will be affected. So the periodontist will give necessary and traumatic and minimally invasive surgery without any profuse bleeding, and he will advise and he will secure the teeth in occlusive condition and healthy condition and very prompt gripping and pounding condition. So in anti-convulsive treatment, the patient along with the assistant should be there, because the convulsions can the patient can get convulsions at any stage by at the time of climbing stairs and at the time of walking side by the road. So the assistant or assistant should be there for anti-convulsive treatment. So the fits and the tremors he may get at any time on the road, because the road is very congested and traffic, there will be head-on collision with the motor bikes or cars or buses or any moving fast moving vehicles, there will be collision. So there will be cerebrovascular emergencies and traumatic conditions or fractures, multiple disseminated fractures, and so many problems patient may get in convulsive conditions. So anti-convulsive drug, the assistant for the assistant should be monitor, and so in anti-convulsive treatment, the oral hygiene should be maintained in good and hygienic and fresh conditions, so that no super infections and no infections transformed into different organs, and patient will be healthy, energetic and cooperative and coherent and very coordinative and very conscious and comfortable with the patient. Thank you.